So, how did you know that you had COVID-19? Tell us the initial symptoms that you had.
Well, I was sitting in my office about 5 days after, 4 or 5 days after what I later found to be the route of infection, and I was suddenly, I mean, it was quite sudden. I was suddenly hit by chills, which I think were probably the most pronounced symptom that I experienced, but also just a lot of fatigue, just feeling really tired suddenly for no apparent reason, and a bit of a strange headache behind my felt like it was behind my eyeballs that just wouldn't go away. It wasn't very severe, but it just kind of lingered and lingered. And so I think initially the symptom that really jumped out at me the most were these chills that I was experiencing. And so I would and later as the week progressed, as the week that followed progressed, that I started to develop what I guess they call night sweats. I would wake up in the middle of the night with I think a bit of a fever because I was really sweating. And then about a midweek in the week that followed, I developed just a very slight cough. But that's kind of what got me thinking about the coronavirus because obviously a cough and a fever are two of the things that are closely associated with this. The one other symptom that I really noticed as well is that, again, later in the week, is I did not lose my sense of smell or taste, but my taste was really altered. Food just started tasting really weird and off, and I completely lost my appetite because everything I ate it really just tasted weird. So somehow my sense of taste was really altered as well.
So, this sounds like something that's different than what most flus or other, sicknesses that we have. It is different, then, right?
It is. I mean, it was, obviously at the time I started feeling sick, I didn't initially think I had, anything to do with the Wuhan, coronavirus, because I just felt like, well, I must be coming down with a flu or something. And I actually felt after a day of rest, I actually felt good again, briefly for about 2 days. I felt fine. I felt normal. Went out and did a hard bike ride and I thought, well, this must have been some sort of a 24-hour bug that I conquered. But no, it's definitely not like other flus because of these rather unusual symptoms. I know a lot of people are talking about this loss of sense of smell and taste, which is a kind of now a tell for having this kind of this pneumonia. So I think yeah, there are definitely some differences between this and other flus.
So, then you went to the hospital to get tested. How did you find out it was COVID-19?
Well, when these symptoms just kept going on and the chills and the night sweats and then to make things a little bit more alarming, I started noticing I was coughing up a little bit of blood,
Oh,
which obviously is scary.
that's not, yeah.
But at this point, I thought, yeah, there's something wrong here. I need to go to the hospital. And so I did go to the hospital, and I walked into the emergency room, and I felt kind of silly actually because I just said, I don't feel well. I want to be tested for this, COVID-19. And they didn't initially do that because I think what they do is they have a screening process, or they did at the time, where they give you an X-ray, chest X-ray, and they check other things like blood work, and they ask a bunch of questions. Where have you been? Have you traveled recently? Have you come back from overseas? And I didn't fit the profile actually. The doctor said, you've been in the country for almost 2 months, and you don't seem to fit the profile. However, he did see some problems with my lungs. Like there was, I don't know maybe what they might call a shadow or something on my lungs. And he said my blood work wasn't normal. So he decided to ask me to stay 2 or 3 nights for observation and some treatment in a private room so that I wouldn't have a chance of infecting anyone with whatever I had. And so yeah, I was there for 2 or 3 days, and it wasn't actually my doctor, the one that signed in my case, kept quizzing me about, have you, where might this have come from, and um, that's when I finally it popped into my head that I just a side thought that a few days before I had started feeling sick, I had actually hosted some friends from Washington State just for a day, and
Oh,
one of them had complained that on the evening of that day that they were down here in visiting me, They complained that they had chills and that they weren't feeling well. So I sent them a message. I hadn't had any contact with them since. And I said, "Hey, are you guys okay?" And immediately the wife of my friend said, "Oh, he got sick with this unknown disease." And then she got sick. And then one of their friends that they were traveling with got sick with the chills and similar symptoms that I had had. Of course, they all seemed to recover fairly quickly too. Within a few days, they were feeling better. But I told my doctor here in Taiwan this, and immediately the alarm bells went off, and they said, "Oh, we got to test you for COVID-19," and that's what they did. And after two tests, I came back with what they call a weak positive result for COVID-19, which was enough to confirm that I had this virus.
So the first test wasn't conclusive?
No, because and they said it's not. I think if you come back with one weak positive, and they told me the first test actually was a weak positive, I think that they felt that that wasn't quite enough to go on, so they gave me a second test, and it came
Mm.
back with the same result. And I think that's one great thing about Taiwan is that they're not. Once they start testing, they're not shy about testing. They just keep testing to either confirm the positive or the negative result, and that's what they did with me.
So once you were confirmed to have COVID-19, what kind of treatment did you receive?
Well, it was interesting before I even had that second test that was positive. The Taichung, the city government here where I live, immediately responded and said, we want to move. We ordered the hospital or requested the hospital move you into a negative pressure isolation room. And so they did that immediately. There was no hesitation about that. And I noticed that the personnel that were caring for me started coming into the room with the full
Yeah.
personal protection equipment, the whole body suit and the mask and everything. And that's when, of course, the alarm bells. I thought, uh-oh, okay, here we are. And so the treatment was a combination. Initially, of course, they weren't sure what I had, and they had started me on antibiotics already. And I know that a lot of my friends have said, well, antibiotics don't treat the virus. But I think they're looking, I've heard about this from other people as well. It's kind of a two-pronged approach because you do have a pneumonia in your chest that's going on at the same time you're infected with this virus, COVID-19. So they were giving me anti-flu medication, which I know is quite common, to alleviate the symptoms. It come with a combination of antibiotics, and I assume the antibiotics perhaps are to prevent further infection or complication from the pneumonia. And so those were the two, and then of course the medication for my cough, which was never actually very serious, but they were giving me some of that as well.
So then, how did you feel after the medication? Tell us about the process of this illness.
Well, I after a few days actually in the hospital, the chills that had really been bothering me, and the fever after several days actually disappeared. I did suffer some night fevers when I was in the hospital, and they gave me something for that. And but after a few days, that even stopped. And the only thing that really remained was a very slight cough. I was still coughing up some blood. And this, a little bit of, maybe a little bit of fatigue. And of course, the loss of appetite. But I think it was about 10 days after I was in the hospital that suddenly, it was funny, in course of one afternoon, my appetite just came back suddenly, and I was eating everything I could get my hands on because food tasted good again. So that came back eventually too. So by the time the treatment, I think, was fairly effective, and of course, I think that COVID-19 is one of those things. There's no cure for it. You just have to get through it and stay. The medications are to help alleviate the symptoms, and then of course you rest and your body develops antibodies against this virus. But by my final week in the hospital, it really had come down to a very, very sporadic cough. I mean, again, I emphasize very occasional. It wasn't bad, and of course then. There was a little bit of pressure in my lungs because of, I think, the effects of this pneumonia. Although, and I say this to everybody, is that I never had a breathing problem. Even taking deep breaths for me was not an issue, for which I'm very thankful, because I know that there have been people with this virus who have had severe complications with breathing. That's why we hear a lot about these ventilators. But fortunately, I did not have that problem.
So how many days were you in the hospital?
A total, I think it was 19 days I was in the hospital. Um, but it's funny because the last few days, 2 or 3 days, actually I was already cleared. They'd already decided that I was fine, but they were just waiting for the central government, I guess it was the CECC, to sign the document, to actually signature the document and send it down so that the hospital could officially release me from the hospital. So I had to wait an additional 2 or 3 days in the hospital while that document was finalized and sent down. So yeah, about 19 days.
So I read in your Taipei Times article that you had got tested 3 times, and it was
Hmm.
negative 3 times before they let you out, right?
Right, right. That's a government regulation here, and I think, of course, there's a lot we're learning about this virus around the world as we go along. But I think, I've had people come to me and say, well, I've heard people in, a few cases where people left the hospital and then they seem to get sick again or something. And everything I've read seems to indicate that people, some countries or some cases, people have been released when their symptoms disappeared, or they were only tested perhaps once and allowed to go home. And then,
Oh.
of course, perhaps they were not completely fine. They still had the virus. So I think Taiwan has done a wonderful job, and that they're very, very careful about this. The rule here is that you have to get 3 negative consecutive tests. And so it's funny because they tested me the first time I got a negative test, I was happy, but then I got my second negative test, and then I got apprehensive because I thought, uh-oh, what if this third test is positive? Then we start all over again. But of course, fortunately, that didn't happen in my case. But it shows the thoroughness of the government is they want 3 negative tests in a row, and then of course it has to still go to discussion on I think the local and the central level. They have to look at the case and say, well, here are the details. Do we allow this person to go home? Are they officially coronavirus free? And so I think it is a very thorough process.
And how else did officials contact you? I mean, did they ask you about all your contacts over the past month? How did that work?
So as soon as that first test came back that said I was weak positive at the beginning, before they even had the second test, they already started contact the local government health bureau personnel started calling me and saying, okay, we need to go over your contact history over the last 2 weeks, basically, or longer. And so they, in the course of a series of phone calls over the next 2 days, they reviewed pretty much everything that I could remember. And of course, I was able to recall quite a bit. I had my calendar book, and I was able to look at where I'd met, who I'd met, where I'd gone. And of course, they wanted to follow up with these people. So then they also had to know, well, how do we reach these people, where they live, or do they have a phone number or something that we can reach them, because they have to follow up. And in some cases, starting with the people I work with, um, they had to have a mandatory quarantine. Not everybody was quarantined. I think they have some sort of gauge for judging who gets quarantined and who doesn't. I think in some cases, people I had much briefer contact with were followed up with by the government, but then they were simply told, you need to monitor your health. If there's any issues, if you see anything, you need to contact us immediately. And so they did a very, very good job at that. And the friends that had visited me from the United States who had infected me, they were also followed up via me. And then later on, we established the local officials established a direct link to them via me, so that they could follow up with them as well in terms of, what flights did you take into Taiwan and leave from Taiwan. Of course, they want to know that. In fact, right down to where were you sitting in the airplane.
Mhm.
They wanted to know, they'd spent time in Taipei. Where had you gone in Taipei? Who had you seen up there? So they followed up directly with them as well. So overall, I thought they did a wonderful job. And I really want to emphasize something, and that is, this was a very stressful time. Obviously, I just found out I had coronavirus. I'm in the hospital, and through this entire process, the people that I interacted with, the local officials that had to make these phone calls, I just felt they were so understanding. They were very calm. They were very polite. They didn't put a ton of, they didn't put all this pressure on me. And they were very friendly and supportive. And I really can't say enough about that, because I think my guess is that there are other countries where that doesn't happen, right? When the people come in and you're being treated almost as a criminal, being interrogated.
That's a
But that
problem.
never, yeah, that never happened here. I just felt like, in fact, even after I came out of the hospital, they had to have I had to sign off on a document. I felt like we were almost old friends by that time, because the interaction had been so positive.
Well, that's good to hear. Well, I think Taiwan has
Yeah.
done a terrific job of taking care of people and keeping the virus contained as much as possible. How are your
Yes.
friends doing? Those few friends of yours who were traveling?
They're doing well. I just checked up on them the last night. In fact, one of them still has a bit of a cough, and she's isolated. And it's actually the chain of infection goes beyond them, because it turns out my friend who wasn't feeling well the night I saw him had seen his mother in the United States, who was the
Mhm.
first one to actually test positive for COVID-19. Fortunately, all of them are doing okay. And one of them actually, even though she was tested positive, she never got sick. So fortunately, they're all doing fine. And I think that that's something I'm very happy about. And I might add that I'm extremely happy that to my knowledge and what I've been informed, I did not infect anybody else while I was sick either. So
Oh, that's
that's a
wonderful.
huge load off of my back as well.
That's wonderful. I think they figure that if you have a 15-minute contact with someone, that one might need to be quarantined. Did they tell you how they figure that out?
They didn't give me an exact standard, and frankly, at the time, I wasn't going to interrogate them too much about. I was kind of just leaving it to them to decide
Right.
how to handle that. Um, I think this is a very tricky situation, because you have the doctors told me later on I had one of the fastest recovery times to date on record in Taiwan, and also I apparently didn't infect anyone else, despite the fact that I had had some fairly significant FaceTime with people. Um, I think there's other factors. We discussed this a bit, with the doctor and me, and I've read about it as well. Is there's things like what they call virus load. How much of the virus are you carrying? Which
Mm.
sounds kind of strange, but it is a factor I've read about. Some people have high virus loads, and some people have low virus loads. So I think that could be a factor as well, in terms of how infectious you are, or how, I don't know, perhaps even how sick you get. I'm not sure on that. But yeah, so I do think that, but I was never informed about a specific standard, although I do know my entire staff, the company I work with, was had to go into quarantine.
Do you usually wear a mask? And were you wearing a mask
Um,
while you were sick?
uh, when I initially got sick, I was not wearing a mask, except for places when I was in public areas and I felt like there was a lot of people around. And so prior to all of this, I was not wearing a mask, because, it was funny. In the very earliest days of this crisis, the Taiwan government was actually telling people that if you're out and about and you're healthy, you don't have to wear a mask. I mean, there was a public
Yeah, I
service
remember that.
announcement saying this, and so, and I was one of those people who kind of felt like, well, that makes sense. It's probably not necessary, and of course, when I was spending that day with my American friends, visiting American friends, I didn't wear a mask. I kind of wish I had now, but none of us were wearing masks. So at the time, was not. However, of course, once I got into the hospital, around my providers, the nurses and doctor, whenever they come to my room, I would put on my mask. And of course, since leaving the hospital, I've been very, very careful about wearing the mask every time I step out of my home, uh, because, I mean, if as many people have pointed out, it's not so much about being infected by other people, but infecting others. Now, I am coronavirus free, but I just feel like I don't even want to take that chance of anything. I just don't want to think about it. I don't want to feel any guilt about it, anything. So I'm just going to wear a mask whenever I go out. And of course, that's what almost everybody in Taiwan is doing right now.
Right. I think there are a lot of new rules out now about wearing masks, in offices and public transportation, and also social distancing rules that we're supposed to follow.
Right,
So, what do you think of
right.
these rules?
I think, anything that can reduce the chance of infection or the spread of this virus by even a percentage point or two, whether it's maintaining more distance between people or wearing a mask, I think I'm all for it. I think it's great. As we've said, Taiwan is doing a marvelous job, I think, and I'm really happy to see it getting more and more credit and notice from around the world for what it's been doing. The media starting to really, international media is really starting to notice this. And I think that people are willing to take these measures, hopefully, because if you see the big difference in Taiwan is that by and large, life has gone on as usual. Children are still going to school, people still go to work, there's still traffic on the streets, and if people can do those things, continue to live their lives, but take these extra measures to reduce the risk of spreading this outbreak. I'm all for it. I think it's great, and I hope it works.
Well, great. Well, Douglas, it's been great speaking with you. We appreciate that you shared your experience, and it's so good to know that you've recovered and that you're doing well.
Thank you. And I just want to add one thing, and I've said this to so many people. I've said this to my doctors and my nurses. I've said this to friends while I was sick and after I was sick. But I really do think, speaking as someone who has come, had the coronavirus and come back from it, I really do feel that I would rather be here in Taiwan. Uh, if I had to catch the coronavirus, I would have rather caught it here in Taiwan than anywhere else. And Going through this crisis, I would rather be here in Taiwan than anywhere else, quite literally. And many people agree with me on that. So again, I think Taiwan is doing a marvelous job in a very difficult situation in containing this outbreak.
And we thank you for sharing, Douglas. So it's been great
Thank
speaking with
you.
you. Thank you,
Thank you.
and hope you stay well.
Thank you very much. You too.